I'm Talitha Vickers. Governor Roy Cooper coming to the podium now with an update on COVID-19 and expected to talk about schools as well. Let's listen in.
56 new cases reported today, 1,109 people in the hospital, and sadly, 1,552 people who've died. The loss of a loved one from COVID-19 can be a difficult and lonely journey, and our prayers are with all of you. As the summer rolls on, I know many children and parents are talking every day about what will happen this school year. In the spring, when this pandemic first broke out, we made the difficult but necessary decision to close in-person learning at K-12 schools and move to remote learning. March feels like a long time ago given everything we've been through. And that was just the beginning of a series of tough decisions to slow the spread of COVID-19 that have helped our state cope and prevented our hospitals from being overwhelmed. The reality is that the disease continues to spread throughout the country, and some states are seeing their hospitals fill up. But the good news is we now know more about how to slow the spread and how to protect ourselves. After working with health experts, school superintendents, teachers, and more, we plan to put those protections in place and open our schools in a careful way. Today we announced that North Carolina schools will be open for both in-person and remote learning with key safety precautions to protect the health of our students, teachers, staff, and families. This is the Plan B that we ask schools to prepare. It's a measured, balanced approach that will allow children to attend but provide important safety protocols like fewer children in the classroom, social distancing, face coverings, cleaning, and more. As a part of this plan, we want local school districts to provide for remote learning options for any child who chooses it. In addition, school districts will have the option of Plan C, all remote learning, if that's best for them. Now, I know parents and students and teachers have questions about what school might look like if they attend in person. I want to share more information about some of the requirements for schools under this plan. So, face coverings will be required for every teacher, staff, and student from kindergarten through high school. The studies have shown overwhelmingly that face coverings reduce disease transmission. To help, the state will be providing at least 5 reusable face coverings for every student, teacher, and staff member. And we've already delivered a 2-month supply of thermometers and medical grade equipment for school nurses. Schools will be required to limit the total number of people in the building so that 6 feet of distancing is possible, for example, when students are seated or in a line. Districts and schools can use a plan that works for them, whether it's alternating days or weeks or some other strategy. Symptom screenings, including temperature checks, will take place daily before children enter the school buildings. Schools must create a way to isolate students who have symptoms to ensure that they can get home safely. Schedules must allow time for frequent hand washing, and schools will regularly clean classrooms, bathrooms, buses, and equipment. Teachers will work to limit sharing of personal items and classroom materials. Non-essential visitors and activities involving outside organizations will be limited. In addition to these and other requirements, schools are strongly recommended to implement other safety precautions, such as one-way hallways and entrances, keeping students in small groups that stay together as much as possible, eating lunch in the classroom if the cafeteria won't allow for social distancing, and suspending activities that bring large groups together like assemblies. We know schools will look a lot different this year. They have to in order to be safe and effective. The public health experts and the school leaders developed these safety rules to protect our students and teachers and their families. They've also developed detailed procedures for what will happen if a student or a teacher tests positive. Plan B is the baseline for our state. However, as I said earlier, districts can choose Plan C, which requires all remote learning, if they determine that that's best for those children, parents, and teachers in that area. But let me be clear. The start of school is a month away for most of our children, and we know a lot can happen with the virus during that time. If trends spike and in-person schools cannot be done safely, even with these safety protocols, then North Carolina will need to move to all remote learning like we did last March. There are no decisions more important than the ones about our children and our schools. This announcement today is the result of careful, collaborative, and painstaking work. As with many choices during this pandemic, we're working with the best information and science that we have today. We know there will always be some risk with in-person learning, and we're doing a lot to reduce that risk. But as pediatricians and other health experts tell us, there is much risk in not going back to in-person school. We know that schools provide so much more than just academic lessons. They support our children's social, emotional, and physical development. They're reliable sources of good meals, and they are a critical line of defense when a student has a troubled home life, including abuse, mental health, hunger, and homelessness. My mom was a teacher, as I've said many times. I've spent time with teachers in every corner of our state. It didn't take a pandemic for me to understand that teachers are some of our most essential employees, pulling from their own pockets to buy supplies, getting in early just to stay late, and even working extra jobs to stay in the profession that they love. In March, our teachers and school staff dove headfirst into the challenge of remote learning and meal distribution. They rose to the occasion. And now we're asking them to rise even higher and dig even deeper. So we must move ahead with the resources needed to protect them. Ensuring this plan protects not just students, but teachers and staff too, is the top priority. I strongly encourage all superintendents and principals to meet with and listen to teachers and staff as they shape their plans. I know this will be challenging work for them, but I have faith in North Carolina's teachers. Today I also announce that when the current executive order expires this Friday, July the 17th, North Carolina will continue to stay paused in Safer at Home Phase 2 for 3 weeks. Now, our virus trends are not spiking like some other states. We have hospital capacity, and our percent positive is still high, but it's steady. However, our numbers are still troubling, and they could jump higher in the blink of an eye. Easing restrictions now to allow more high transmission activities could cause a spike that would threaten our ability to open schools. The most important opening is that of our classroom doors. And we want to be done with this pandemic, but it's not done with us. We'll continue toward the school year working together with everyone's safety in mind. Lastly, let me tell you about the easiest and most effective way we can ensure our children go to school in August and ease economic restrictions as well. Wear a mask. CDC Director Robert Redfield said that if everyone could wear a face covering over the next 6 weeks, we could drive this virus into the ground. Let's do that for our children, if nothing else. I'd now like to ask Dr. Mandy Cohen, our Secretary of our Department of Health and Human Services, to say a few words about this plan and what went into it. Mandy?
Well, thank you, Governor. Before I dive into some of the science and data related to children and schools, I wanted to provide a quick update on our key metrics. I'll do a deeper dive with all the graphs later this week, but in summary, our trends look about similar to last week. Our surveillance data, which is our early warning metric, that looks at people who come into the emergency department with COVID-like symptoms, it's still increasing. Our case numbers, as the governor said, continue to trend upward. The percent of tests that are positive remains level, but higher than I'd like. North Carolina's trajectory of hospitalization has continued to tick upward, but we still have capacity. Related to our response capabilities, they're largely stable, though we continue to see longer wait times for test results as our national commercial labs are swamped and our hospital labs are having supply challenges. These are not issues that are unique to North Carolina and are happening around the country. States need federal assistance, as we can't solve these issues alone within North Carolina. So in short, we continue to simmer, but we've avoided boiling over, as many states are doing now. We will continue to watch our trends closely. If we see indications that we're changing quickly or there's new scientific data that emerges, we will not hesitate to act. Planning for the upcoming school year in the context of this pandemic has been full of difficult decisions. And we recognize that there are no perfect answers. In developing the plan laid out by the governor, our department looked to the science and medical evidence to guide us at every step of the way. The scientific evidence available today shows that children are less likely to be infected with COVID-19 and children get less severe illness than adults. Importantly, children who have COVID-19 are also less likely to spread it to others, even in school or group setting. This is particularly evident in younger, elementary-aged children. We also looked at data from around the world, indicating that schools are a lower transmission setting and have not seemed to play a major role in spread of COVID-19. We weighed these factors against the conclusive evidence that school is critical to a child's education, health, emotional and social well-being, and that missing school is actually harmful to children. With any hard decision like this, it's necessary to weigh the risks and the benefits, and there are no easy answers. So after looking at all of those risks and benefit, we've decided to move forward with today's balanced and flexible approach, Plan B, which allows for in-person instruction as long as key safety requirements are in place, in addition to remote learning options. In arriving at this approach, it was critical that students and families have the option to choose remote instruction based on their own unique health and risk considerations. While the emerging evidence shows that school is a lower risk setting, we need to reduce risks for students, teachers, and staff even further. That's why our guidance, as the governor said, requires all students and teachers to wear cloth face coverings and maintain a distance of 6 feet. We also added guidance for the precaution of the adults in the building that they need to take when interacting with one another. With these measures and the additional robust public health requirements in our guidance, we can mitigate, but not eliminate, the health risks of reopening. While these policies need to be in place to reopen, we also know the new measures we're requiring of schools will not be easy to comply with. That's why, over this summer, our department has worked hand in hand with our state education counterparts and with school districts. We've listened closely to the needs and concerns of North Carolina's students, parents, and teachers. As the governor shared, we will provide 5 cloth face coverings for every student, teacher, and member of the school staff, 1 for every day of the week. School nurses have already received shipments of personal protective equipment and guidance on how to manage suspected cases of COVID. In addition, school staff have received flow charts on how to screen students and take appropriate next steps. And custodians and bus drivers are now equipped with new checklists on cleaning, disinfecting, and sanitizing. Today's new policies create a baseline of health and safety during COVID-19 that every public school in North Carolina will have to follow. But in the spirit of flexibility, school districts will be able to exercise even more caution and choose option C, remote learning only. But no school districts may fall below this baseline of Plan B. We've never faced a pandemic like this one before. I know that for all of us, this has been a very stressful reality. I can't tell you with certainty what the future holds, but I do know that Governor Cooper and our department will be in constant communication with school communities, offering resources and support as we all find our way through this together. In the meantime, there are 3 simple steps everyone in North Carolina can take to limit the spread of the virus and keep our school doors open. Practice those 3 W's: wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. Wear, wait, and wash. Thank you, Governor.